Have you noticed when an elderly person starts to change subtly, losing weight for no apparent reason, withdrawing from conversations, sleeping more than usual? Could that just be getting older? Or might it be something far more serious? The truth is harsh, but it needs to be said. There are silent signals that someone may be in their final year of life, and most families simply ignore those warnings until it's too late. In this video, as a geriatrician and longevity researcher, I'm going to reveal 5 hidden and chillingly precise signs that show when an older person's body is entering an irreversible decline. These signs are serious, urgent, and often misinterpreted even by healthcare professionals. You need to know each one, especially if you want to provide a dignified, healthy, and fulfilling old age to someone you love, or even to yourself. Before we begin, if you value content that truly teaches how to care for health in later life, subscribe to the channel. This isn't superficial talk. It's practical, transformative medical information that can extend lives and prevent needless suffering. Each sign I'm about to reveal today is like a secret code from the body, and if you know how to read it in time, you can change the game completely. Understanding these symptoms can mean the difference between a silent farewell and a renewed vitality. Don't skip any part. The last sign, above all, is the most overlooked of all, and perhaps the most impactful. Let's go straight to the first sign. And get ready. What you're about to discover now could forever change how you perceive aging. Have you noticed when a garment that used to fit snugly starts to hang more loosely, even without any changes in diet? Well, that could be one of the most subtle and dangerous signs that an older person's body is entering a stage of decline. Unexplained weight loss, especially when accompanied by a lack of appetite and loss of muscle mass, is not something you should ignore. Far beyond aesthetics, it's a silent alarm that the body is struggling to absorb nutrients, which can profoundly compromise health in later life. In some cases, the body seems to be turning off lights one by one, conserving energy for vital functions. This weight loss can develop so slowly and discreetly that family members only notice once it's become obvious. It's common to hear comments like, "They're just eating less because they don't feel like it," or "It must be normal at their age." But no, it's not normal. A study by the National Institute on Aging warns that losing more than 5% of body weight in under 6 months should trigger urgent investigation. And we're not just talking numbers. We're talking well-being, longevity, and prevention of diseases that often go unnoticed until it's too late. When weight loss persists despite adding high-calorie foods and nutritional supplements, something is wrong. And here's a little-known secret outside geriatric clinics: that symptom often precedes, by months, serious diagnoses like cancer, heart failure, and kidney failure. According to Canadian geriatrician Dr. William Thomas, in older adults, weight is like the flame of a candle. When it begins to flicker, it's a sign the wax is running out. And look closely. This isn't meant to scare you, but to alert you. There are possible paths forward. There is prevention. There is hope, provided we know how to look carefully. Our role as healthcare professionals and attentive family members is to create real strategies to interrupt that silent cycle. Small daily changes make a difference. Include high-protein, calorie-dense foods like eggs, avocado, and olive oil, break meals into small portions throughout the day, and respect the elders' pace, as they may no longer be able to eat as before. I recall a patient who, with a simple bedtime porridge enriched with oats, whole milk, and mashed banana, regained some of the lost energy. It wasn't a miracle, it was care in lifestyle habits and a focus on healthy aging. But beware, it's not just about eating more. You need to investigate why the weight is dropping. It could reflect something hidden, a sort of encrypted message from the body. And when we decipher that message in time, we open a powerful door to resilience and recovery of quality of life. Longevity medicine teaches us that the secret isn't just living longer, but living with dignity, well-being and presence. And that begins when we learn to notice what many ignore, the small signs. Imagine a lady who always enjoyed tending her plants, sweeping the terrace and making her own coffee. Suddenly, those simple tasks become difficult. She starts saying, "Not today, I'm tired." And that tiredness isn't fleeting. It's exhaustion that doesn't improve even after a good night's sleep. We're looking at a clear but often neglected sign. When an older person's body begins to conserve energy because there are no reserves left to spend, it's as if the metabolism switches into energy-saving mode, trying to preserve what remains of vital strength. This kind of fatigue is different from what we feel after a busy day. It's constant, deep, and manifests even at rest. Science shows that as the body ages, there's a natural decline in mitochondria, the cell's power plants. When this decline accelerates due to chronic disease, poor nutrition, or degenerative processes, the person lives in a state of exhaustion. Health in later life depends greatly on the ability to stay active, but when the body can't respond, it's time to dig deeper into the accumulating risk factors. Many families think it's normal for an older person to want to sleep all day or not get out of bed. But what few know is that increased sleepiness and weakness can be early indicators that we're nearing life's final cycle. And the most intriguing part is that this transition, although silent, can be perceived by an attentive observer. The elder who used to join conversations and laugh at family jokes begins to drift away in silence. They're there but distant, as if gradually saying goodbye with delicacy. In those moments, disease prevention must give way to attentive listening and companionship. A good chat, encouragement for light walks, or even a foot massage can help restore a bit of lost energy. There are also valuable nutritional resources. Tryptophan in bananas, for instance, aids serotonin production and can ease that constant fatigue. The key is respecting the body's pace without losing connection with what still gives meaning. Longevity medicine isn't just technique, it's loving presence. There's a kind of silence that isn't just a lack of words, it's an absence of presence. You know when an elder who used to be talkative starts to withdraw, responding in monosyllables or seeming elsewhere, even when they're there. That withdrawal, when sudden or increasing, can be one of the most sensitive signs that the body and mind are entering alert mode. And what's surprising is that often there's no prior dementia. Confusion comes and goes, as if the brain alternates between windows of lucidity and foggy lapses. It's common to hear stories like, they forgot their grandchild's name, or they asked 3 times what lunch was. Many think it's just aging, but it's not that simple. Those cognitive oscillations may indicate hidden infections, like a urinary tract infection, that often show no obvious physical symptoms in elders, or they could signal a silent pneumonia. Science shows that the aging brain responds differently. Confusion precedes fever. Isolation precedes pain. And this, my friend, is one of the most treacherous traps in elder health. The mind is the mirror of vitality. When it starts to fail, even in small lapses, it's time for heightened attention. One of modern geriatrics' great secrets is understanding that social withdrawal isn't laziness or stubbornness, it's a mechanism of a body in distress. A patient who stops joining family gatherings and prefers to sit alone in the dark may be showing that something deeper is out of balance. Healthy aging depends above all on connection with the world and with others. Here's a powerful key: cognitive stimulation. Simple habits like reading aloud, playing dominoes, listening to old music, or looking through family photo albums have a direct impact on the elderly brain's neuroplasticity. Adaptogenic infusions, such as ginseng or Bacopa monnieri, have also been studied for their effects on mental clarity. Plus, re-establishing a routine with well-defined times for meals, rest and activities can help the brain stay more oriented. All of this contributes to well-being and strengthens emotional resilience. Have you noticed how certain colds that used to last 2 or 3 days now drag on for weeks? Or how a small blister from new shoes simply refuses to close? Well, when an elder's body starts showing recurrent infections or takes ages to heal simple wounds, we're facing a profound sign. The immune system is weakened. This goes far beyond ordinary low immunity. It's the body signaling that its natural defenses aren't what they used to be. Regenerative capacity is one of longevity's pillars. When it fails, the body's balance begins to crumble bit by bit. Repeated urinary infections, pneumonia without fever, herpes outbreaks, they're silent alerts that the body needs help. And here's a detail few know. In many elders, antibiotics lose effectiveness. What used to clear up in 7 days now requires multiple, stronger, more invasive courses with greater side effects. This, of course, further wears down the body and directly impacts health and well-being. The skin also betrays this decline. Wounds that become ulcers, cuts that easily get infected, unexplained bruises, they all tie back to poor circulation and decreased collagen production, natural in aging. But look, this isn't a death sentence, it's an invitation to change. Many of my patients drastically improved their healing ability with simple dietary changes, more citrus fruits, dark leafy greens, lean proteins, and of course plenty of water. As Dr. Le Ribeiro said, those who have no time to care for their diet will have to make time to care for their disease. Another valuable point is the gut microbiota. Few know, but a healthy intestine is the body's first line of defense, and with age, it easily becomes unbalanced. Frequent antibiotic use, poor diet, and a sedentary lifestyle all contribute to immune fragility. Consuming natural probiotics like yogurt, kefir, and fermented foods can greatly help restore this protective barrier. This, combined with healthy habits and risk factor control, makes all the difference in disease prevention and promotion of healthy aging. There's something deeply symbolic about the way we breathe. The breath of life, as the ancients said, is also one of the first signals that something is changing in the body. When an elder's breathing becomes irregular, sometimes rapid, sometimes slow, with long pauses between breaths, we're witnessing a subtle but powerful sign. The body is reprioritizing, redirecting oxygen to vital organs and reducing flow to the extremities. This change is silent, often only noticeable at night when the person seems suspended between two worlds. The pattern known as Cheney-Stokes respiration is one of those signs few recognize. It comes in waves, rapid breaths followed by long pauses, as if the body forgets how to breathe. When this begins, especially during sleep or rest, it indicates that the brain and respiratory system are falling out of balance. Circulation also gives clear signals: cold hands and feet, bluish or grayish skin tones, purplish lips. Blood is being shunted to the heart and brain, leaving the limbs with less warmth and oxygen. It's the body's dignified struggle to stay alive with what's left. But look, this doesn't happen overnight. Often these changes appear weeks before the end. And however subtle they may seem, they're striking. The elder may start to feel breathless climbing just a few steps, or even while sitting without exertion. That's an alarm. And it's not a sign of weakness, but of an internal battle where the body fights with dignity. At that moment, the focus must be comfort, companionship, and constant monitoring. There are breathing techniques and palliative interventions that can significantly improve quality of life at this stage. An essential aspect of care is the environment. Poorly ventilated, cluttered, or overly humid spaces can drastically worsen respiratory issues. Adding humidifiers, eucalyptus essential oil, or even a good reclining chair to aid breathing are simple yet transformative measures. Also, monitoring with a pulse oximeter and regularly measuring oxygen saturation help map these changes precisely. Healthy aging medicine shows that even in the most fragile moments, disease prevention and well-being can be promoted with small but intentional actions. And perhaps what moves the heart most about this sign is its sensitivity. Breath doesn't lie. It reveals the rhythm of life, the fatigue of the journey, but also the courage to continue. Observing these changes with compassionate eyes is the first step to offering an elder what they need most at this stage: dignity, peace, and presence. Because in the end, it's not about prolonging life at any cost, but ensuring that every breath is met with respect and love. Now answer me honestly. Have any of these signs already appeared in your home, in your family, or in someone you love? How many times have we ignored these subtle warnings, thinking it's just part of getting old, without realizing that the body is crying out for attention, for care, for presence? Leave it in the comments. Have you experienced something similar? Have you seen someone lose too much weight, isolate themselves, be tired all the time, and no one could explain why? Share your story. It could be the light another viewer needs right now to see something they hadn't yet noticed. And look, if this video moved you in any way, don't leave it for later. Subscribe to the channel and hit the notification bell. Here we speak seriously about health, well-being, resilience, and longevity. No gimmicks, no magic formulas, with truthful, transformative information, just as you deserve. Each new video is designed to help you live longer and better, preventing disease, recognizing ignored symptoms, and building step by step an active, respected, and vibrant old age. And if you know someone who needs to hear this, share this video now. It could be the push they need to seek help or change course. Stay tuned for upcoming content that will appear here on the screen. The journey of discovery about the body, the mind, and the signals no one else is telling you continues. Take care. See you in the next video. Until then.